I served during an interesting transition in ACRM's ownership of the Archives of Physical Medicine and Rehabilitation. For many decades, we were co-owners with the American Academy of Physical Medicine and Rehabilitation of the archives, and we had some very interesting discussions with their leadership over the ownership and the future of the journal. It's certainly one of the crown jewels of ACRM, and we wanted to make sure that it was intact, continue to serve ACRM members' needs. I'm pleased to say that the journal has continued to thrive since then. It allows us to focus on the needs of ACRM members, the emerging special interest groups, and the various networking groups that comprise ACRM today. I really am pleased with the composition and the contributions of the editorial board members. They represent the diversity of rehabilitation professions in the field, a variety of expertise, whether it's bench science, whether it's clinical expertise within different disciplines. Nursing and allied health contributors as well are represented on the editorial board. So it's been a real delight to work with them to help contribute to the quality of the science that we report and on which clinicians and scientists and patients and their care partners depend for quality information about rehabilitation.
I was really fortunate to be part of the Archives Steering Committee when we discussed and founded ART, the Archives for Rehabilitation Research and Clinical Translation. And the reason I like it so much is because just the name of it highlights what ACRM is all about. Archives is a collection of the most rigorous research that can have great impact on rehab medicine. ART takes it a step closer to taking information that might be clinically relevant, provides the evidence for it, and helps get it closer to clinical translation and clinical practice. It gives another opportunity for researchers who are doing very meaningful work, but maybe didn't reach the bar for archives yet. It needs to get out there. It gives it a vehicle to get that information out there in a meaningful way so that clinicians can start using that information, using that evidence to change their practice, to get the best impact and outcomes for their patients.
So Archives offers both the traditional model where authors upload and readers may need to pay a fee to read the content, but we also offer authors an opportunity to publish open access. Daughter journal, Archives of Rehabilitation Research and Clinical Translation, that is an entirely open access, only online journal. So it's for all the content is free for readers to consume, and authors have I think, a very competitive open access fee, which is again discounted for ACRM members.
There are two big challenges in the research that we do in rehab medicine, and ACRM embraces both of them. One is we want to have the most rigorous research. We need to get funding for the most rigorous research, and we also then need to disseminate the findings from that research. And Archives, it offers us that opportunity for that. The other problem is disseminating that information in the most meaningful way to as many stakeholders as possible. And there are barriers for access to journals. Many people in smaller clinics can't access those journals easily. Patients can't access the information in those journals. Open access gives us the opportunity to disseminate information that is very meaningful and relevant, disseminate evidence so that it can be used by our stakeholders, by clinicians, by patients and families, and others who might not otherwise have access to journals that are not freely available.